My brother and I were very tight. Unfortunately, he died back when I was 19. He was 21. He took his own life. And I was trying to figure out a way to honor the memory of my brother. And the fact that we already offered scholarships at Palm Health Foundation, and I was well aware of the fact that we face a shortage for behavioral health professionals, I thought, what better way than to name a scholarship in memory of my brother's honor. Just knowing that there is an individual who I am supporting them on their next step down the road of becoming a behavioral health professional, I find it tremendously fulfilling.
I'm currently a doctoral student at Barry University School of Social Work. I'm in my second year, and thanks to the foundation, I have been able to continue my education. And my research focus is neuroscience and helping males with mental health issues, behavioral health issues with a focus on eating disorders. I'm a survivor of trauma, childhood trauma. So what it does to me, I pay it forward to people. My therapy style, my counseling style is extremely down to earth, practical, but I'm giving back to others that are sick and suffering. I'm eternally grateful for the scholarship because without that money, my daughter comes first. She's 13 years old and her education comes first. But without that scholarship, I wouldn't have an opportunity to seek a doctoral education.
My sister had a baby and he was not well. He spent 4 months in 3 different NICUs. He did end up coming home for a month before he passed, and I was one of the people that knew how to provide or learned how to provide all his care. And just through that whole experience and watching the nurses, I knew I had to do it. And that's when I decided to make the career change and go back to school to be a nurse. At the time of finishing my prerequisites and applying to nursing school, or I had already applied and just found out that I got in, my husband was diagnosed with hydrocephalus and had to have a brain surgery to put in a device called a shunt so that it would drain his spinal fluid. I was going through all of that, so now my husband's out of work. It was all really hard times, and the financial burden that it created was serious, and being able to be supported by others with the scholarship is what kept me going through everything. Because at any point in time I could have stopped, but I thought, nope, these are my goals, this is what I want to do for my family, and there's people out there who care. It's incredibly gratifying. I feel that what I do makes a difference.
I would love to say thank you to all the folks who donated to my brother's fund. A number of family members, friends, others who miss him as much as I do, but want to really not only honor his memory, but in paying attention to what has been going on in the past 30 years and the need to do better in behavioral health. I just want to say thank you.
I wish to thank the donors. I wish to greatly thank for this opportunity has been life-changing for me.
With that support, I was able to keep going, and now I get to pay it forward to others. So their support and care really has made the difference.
These 2 scholars, I mean, their stories are so special, but every one of our scholars has a special story. And we want to just allow these great people to not have as many barriers as they do. One barrier that we can help take away is that financial piece. So if we can just take one barrier away, I would love to do that to allow these great people to get into the healthcare profession where they belong.